Hello, good morning, everyone. Can everyone hear me? Hi, morning. If you guys can hear me, please number one in the chat. Okay, perfect. Hello and good morning. My name is Ika, and I'll be your moderator this morning. Welcome to the role of Nutritional and Botanical Medicine in Cancer Treatment webinar. We hope everyone is doing well today. Please make yourself comfortable while we set up. We will begin the webinar shortly. We're just waiting for a few more participants to join us. So in the meantime, comfortable, Good morning, everyone. Welcome to SOL's Cancer Treatment webinar. Thank you for joining us today. Can I just check with you first? Can everyone hear me? If you guys can hear me, can you send number 1 in the chat? Okay. Can everyone hear me? All right, perfect. Okay. So if you guys have any issue, please do let us know. And then we will try to rectify the issue, yeah? So thank you for joining us today. My name is Ika, and I'll be your moderator this morning. Today, our topic of discussion is the role of nutritional and botanical medicine in cancer treatment with SOL's integrative and functional medicine doctor, Dr. Lydia. Before we go on further, please be informed that we'll be sending the access link to watch today's playback webinar via your registered email. In case it does not appear in your inbox, kindly check it in your spam folder and click report as not spam button to ensure that you can receive our future webinar notifications and more updates from us. Before we begin further, I would just like to give you guys a little bit of introduction of today's topic. In this talk, you learn exploring the current status of evidence for nutritional intervention in cancer treatment and learn about the latest findings and advancements shaping the field. Number 2, understanding the role of single nutrition which may be beneficial in preventing cancer or impeding its progression without comprehensive dietary intervention. Exploring the power of phytochemical-rich food in cancer management and uncover the science behind these natural compounds. And there are a lot more that will be covered, but I will leave that to Dr. Lydia. So feel free to write your questions in the chat as we go through the presentation. Dr. Lydia will be attending to your questions during the Q&A session at the end of this talk. Before we go on further, I would just like to give a little bit of introduction of our presenter today. Dr. Lydia De Vega is SOL's integrative and functional medicine doctor who has over a decade of experience practicing integrative medicine. She was formerly the director of the Jasmine Foundation, a renowned NGO specializing in integrative and alternative medicine. As one of the first recognized homeopaths in Malaysia, Dr. Lydia has been offering consultations in homeopathy and functional medicine for both local and international patients for over 10 years. During her training in Shard Homeopathic Hospital Complex and Research Center in India, she received mentorship from esteemed homeopaths. Committed to spreading knowledge, she conducts courses on functional medicine and basic homeopathy for students and practitioners seeking integrative clinical approaches. Her specialized skills, her specialized disease also includes cancer, autoimmune and skin disease, chronic kidney disease, gut health, hypertension, diabetes, depression, anxiety, panic attack, and more. With that being said, I would like to welcome Dr. Lydia. Doctor, please feel free to begin the webinar whenever you are ready.
Good morning, everyone. Can you hear me clearly? All right, okay. Today's topic will be on the role of nutrition, yeah, and also botanical medicine in cancer treatment. As now cancer has become a common condition that we received in our practices or clinic on a daily basis. So I believe that this part of topic is very much important in order for us to enhance the treatment and also the protocol. Okay. Okay, let's look into the current status of evidence, especially in dietary intervention or nutrition intervention in cancer treatment. So, is it chemotherapy and radiotherapy are essential in treating solid tumors? Okay, the study has stated that diet intervention together with the conventional treatment shows a significant improvement in patient because in this study they have segregated in 3 groups. Group 1 received mainly the conventional treatment. Group 2 receiving integrative and integrative treatment, and Group 3 receive a holistic approach where the conventional plus the diet as well as some of the TCM treatment. So what happens was the Group 3 that received a holistic approach together with the dietary intervention have shown to reduce cancer growth and slow down the progressions of disease. Okay, let's look a little bit on nutrition. Why it is important? See, when patients going for a chemo or a radiotherapy, it affects it doesn't only affects the cancer cells, but it also damages the normal cells. So it is very important for us to advise our patients, or even if one even if your patients joining this talk, I emphasize on getting the knowledge or the consultations on nutrition, because nutrition is vital in fighting cancer, and it does affect the gene expression. How it is so? So when we eat a food, molecules in the food interact with the molecule that attach to the DNA through metabolic systemic. So now when there is communication that's happening, interactions that's happening between the molecules, it does affects the gene expressions. So the food that we ate definitely has a bioactive compounds that is proven in many studies to prevent and also treat cancer. As we can see, malnutrition is common in cancer patients due to, maybe they have lost the appetite, and due to side effects from the treatment, and it worsens their condition. So providing a proper nutritional guide as well as detoxification support is very crucial in dealing with cancer patients. So a holistic approach includes a dietary intervention alongside with conventional cancer treatment. Okay, as we receive patients normally in cancer consultations, so this is the most difficult part to deal with. So because patient has already accustomed to certain type of lifestyle and diet, and then and already they are going through a challenging a time battling the cancer, and when nutritional part become a topic in many patients, it become a very difficult thing, is because all of us have different palates. We like certain types of cooking, we like certain way of preparing, or we love certain food that it's, it has been staple for us. So it is not easy, but it is good if we can intervene with our treatment approach. So nutrients in the form of nutraceutical drugs. So there are two different, it is not different, they are similar, and it's different approach. Nutraceutical drugs are those substances that has been proven to treat a disease. Unlike dietary supplements are important for treating the deficiencies, or is just an additional to what we have been eating. So after recovery from a cancer treatment, maintaining a whole food diet helps while sustains remission. Okay, treatment alone may not cure cancer. Poor nutritional management can worsen the symptoms and outcome. Bad nutrition can lead to reduced repair and healing. Many cases it causes weight loss, cachexia, fatigue, and other complications. And malnutrition, not eating enough, not eating the right food, directly contribute to death, especially 22% from the previous study in cancer patients. Okay, so many of our foods, as proven in studies saying that it is cancer preventive. It has phytochemicals rich like antioxidants, flavonoids, minerals, vitamins, proteins, and healthy fats, which we'll look into it in a bit. So these cancer preventive foods are available. It's there in the market, it's there in our house. It's just that we have to know which one that suits the type of cancer, and which one and how to prepare the food. Okay, remember, overeating, overfueling yourself can cause problems like insulin resistance, hyperinsulinism, hormonal imbalance, inflammation, and also it causes metabolic aging. Okay, single vitamins, minerals, and antioxidant in the absence of comprehensive diet intervention have a limited ability to prevent or inhibit the cancer. Okay, so these are the points adapted from previous studies. So it shows what type of food or way of preparing food as causes or has the risk of cancer. So let's look at it. So those foods that are salt based, yeah, salty. So for those who love salty food, be very careful because those foods raises the risk of stomach cancer, and alcohol consumption increases the risk of various cancers. Cantonese style foods, which is mainly they are very hot, yeah, and it's sometimes rich in a lot of soy base. So this has a risk of nasopharyngeal cancers. Processed meats like bacon, salami, ham increases the risk of colorectal and also stomach cancer. And what about these red meats, which often advised not only in cancer, in even autoimmune conditions or kidney cases. Red meats is good to avoid because the modern farming technique has ruined everything. So whatever that you eat nowadays, it has been polluted, it has been adulterated, it has been injected with hormones, it has been injected with antibiotics. So what comes on the table, it's no longer, holds its originality. So it has been adulterated. So therefore, choosing wisely will be a right choice. Okay. Next will be high glycemic loads diets, which raise the risk of endometrial cancers. Aflatoxins. So these are the toxins that you get it from fungal, yeah, and it risk liver cancer. It give a high risk of liver cancer. Aflatoxins are not able to be excreted out of the system. And there's another toxin that comes under the same family, which is mycotoxins as well. So these are the toxins that you find in your cereals, your spices, peanuts, especially nuts, your Brazil nuts or your almonds. So it is good to soak your nuts, sprout your nuts, and hydrate them before you eat. Okay, so these are based on worldwide research data. So I've collected some of the data here. It is advisable for cancer patients to be on a lower calorie food and avoid sugary drinks. Increase consumptions of whole grain vegetable, fruits and beans. Limit intake of red meat, especially processed meat. For cancer prevention, if can, avoid taking alcohol, avoid moldy grains, like what I mentioned just now, that rich in aflatoxins. Arsenic is a very poisonous metal, toxic. You can have it in the body. So when we do HTMA test for some of our patients, heavy metal mineral analysis, patients are found to have arsenic, and arsenic does mutate your genes and give rise to cancers, especially skin cancers. And increase milk and dairy consumption also associated with non-Hodgkin lymphoma cancers. Okay. Phytochemicals rich fruits and vegetables. So many research has said that phytochemicals are chemicals that produced by produced in the fruits or your plants. So they have multiple anti-cancer activities. But if it is used wisely, then it has a synergistic combinations. Okay, if you can see on your left, I guess it's your left. Yeah, phytochemicals, mainly carotenoids, which is those you can find from your carrots, broccoli, red, orange, green fruits. These are beta-carotenes, lycopenes, lutein, and zeaxanthin. They are known to inhibit cancer growth. Okay, so there are many types of phytochemicals. Let me just go through it. Flavonoids, indole, which is mainly high in cruciferous vegetable. Um, you have phytic acid, okay, which helps proven to retard the cell growth. Isoflavonoids inhibit tumor growth mainly in your soy products. And then you also have polyphenols, isothiocyanates, and also terpenes. So these are the main phytochemicals found in our daily vegetables and fruits that we have been eating. So the following chart, it's from the American Institute of Cancer Research. And this study has described how these phytochemicals are helps in fighting the cancer used together with conventional treatments or integrative treatments. But talking about conventional treatment, when certain phytochemicals are given, phytochemical rich fruits or food are given to the patients, we have to be very careful. We have to be very careful in terms of the supplements that the patient is taking, because too much of antioxidants rich supplements, it is not advisable to give together with conventional treatment like chemotherapy. Okay, so in conclusions, phytochemical food, it stimulates the immune system for better defense, which which mean the cancer patient needed. Block the substance from becoming carcinogens. It reduces inflammation linked to cancer growth. It helps to repair the DNA and prevent DNA damage. It minimizes the oxidative damage to cells, which is a cancer trigger. It slows the growth of cancer cells. It forms the damaged cells to self-destruct before reproducing, and also it regulates hormone levels, prevent hormone-related cancer. A study also says that phytochemicals act as a chemoprevention, mainly because they hinder cancer development by preventing DNA damage. They can also repair mutated genes, slow cancer growth, and help abnormal cells die more quickly. So, in simple, dietary changes to include more phytochemical based food, and it is safe, cost effective way to prevent cancer. So it is advisable when we have cancer patients to tailor make their diet, includes all the phytochemical based foods into their diet, and also to look into what type of treatment are they undergoing, and if they are on chemo drugs, it is very important to be mindful of what type of supplements and also food that is being introduced to their regimes, because there are many questions, especially on it is not advisable to give antioxidants in patients who are receiving chemotherapy. This is mainly because chemotherapy drugs in many aspects, it causes an oxidative stress, okay, because those are targeting the cancer cell and it causes oxidative stress. On the other hand, antioxidants has the opposite effects where it act as an antioxidant. So it may blunt the effects of the chemotherapy and it may make the chemotherapy ineffective. So most of the time patients will be advised by the onco that not to take any form of antioxidants while on chemotherapy. So if you are taking any herbs or if you are taking any supplements or even intravenous therapy, it is good to check with the attending doctor or your oncologist whether or not it is okay to take supplement that is highly in antioxidants. Okay. So some of facts that I adapted from the journal that we are talking about. Okay, a study published in the journal Food Chemistry on anti-proliferative and antioxidant activity of common vegetables. So it is advisable to do juicing. Okay, and juicing promise in inhibiting the proliferation of various cancer cell. Vegetables, in this study, it shows that vegetables with very high activity on cell proliferations are those indoors, which is the cruciferous, like Brussels sprouts, cabbage, garlic, green onion, kale, leek, and spinach. Unlike vegetables that are from nightshade, if you can see, they shows an intermediate effect. So why is it called nightshade? Any idea? Why does tomatoes, potatoes, eggplants are called nightshade? Any patients will ask, why doctor is it called nightshade, and nightshade known to have loads on nutrients, and why is it advised to be lower down the intake of nightshade? Simply because nightshade consumption produce a protein, lectin, and also solanine, which in if you consume them in a big amount, then it's gonna cause inflammatory bowel diseases and also leaky gut issues. And why is it called nightshade? Because nightshades, there is a theory where these vegetables, they grow under the shade, and they bloom when it's night, so that's why they has nightshade. So we do advise our cancer patients to take very low intake of nightshade vegetables, and increase more on indoors based vegetables. Okay, so there is probably no magic bullet food for cancer, but rather a synergistic effect among many anti-cancer food will be most effective. Because when you deal with different type of cancer patients, sometimes like what I mentioned, there are many factors that need to be taken into account. What are the treatments? What are the supplements? How is the patients mentally, physically? Whether they on any TPN, or whether they on any condition where they have difficulty in digesting their food, or they have gut issues. So to get into a food or a nutritional advice, it has to be a very thorough job to get to understand the case, and then sit down with the patient and also get a tailor-made diet plan for this cancer patient, because that will definitely going to benefit them. And like I said, there's no magic bullet food for cancer. Everyone receive different dietary approach. Everyone receive different supplementation as well. Okay. So now this is a very common thing, diet and inflammation. So definitely inflammation is the risk factor for progressions of cancer, not only cancer, for many other diseases. And the National Cancer Institute states that over time, chronic inflammation can cause DNA damage and lead to cancers. As I mentioned, with the modern farming technique nowadays, it's not only food is being injected with hormones and also antibiotics, but they are rich in insecticide, herbicide, pesticide. So when patient comes, we ask patients to get food from the organic shop. Try to be as organic as possible. And sometimes it is not doable because many factors are involved. Again, we don't have much places that we can go and get our stuff. Second is the cost is matters, and it is not easy, and how do we measure exactly whether it's organic or not organic? So there are many factors involved, many concerns arises when we have this kind of consultation with the patients. So research indicate that diet rich in saturated and trans fat contribute to inflammation, while food abundant in omega-3 fatty acids linked to reduced inflammation. So First step is find out food that is rich in phytochemical and eliminate food that could cause inflammation, and then get a right approach, way to prepare your meals. What are the ingredients to be included into your cooking, and then get a personalized diet plan from your consulting doctors. That would definitely going to give you a better quality of life. And food that is highly glycemic loads will definitely going to cause inflammations. Okay, so there is a term says that sugar feeds most cancer. See, cancer cells, they are very greedy. Okay, what happens is tumor, it triggers the fat cell in producing this particular protein called IGF-BP1. So when this tumor is triggering fat to produce that protein, IGF-BP1, so now the IGF-BP1 will be high. And this protein will make your normal cell and your healthy cell less sensitive to insulin. So now what happens? These tumor cells have more room to use up the glucose from the insulin. So because that is how they survive and they divide. So this is very important. We always tell patients, oh, don't take food that is highly in sugar. Try to avoid food that is highly in carbs. Sometimes patients don't understand why it is so. So we have to be very careful. High dietary sugar intake associated with many cancers. Not only cancers, in general, it causes inflammation. And insulin resistance is linked to increased incidence of cancer. Cancer cell metabolizes glucose, sugar, more than the normal cells. So studies mention that cancer patients increase glucose production in the liver by 25% to 40% compared to a normal patient. And insulin is a general growth promoter. Okay, and it causes insulin resistance, and which is highly pro-inflammatory, which increase your IL-6, CRP, and also your nuclear factor. Okay. A study says that hyperinsulinism is seen in about 45% in early cancers, but rises to about 75% in advanced cases. So that is why your doctors will always tell you that try to go low on sugar and carbs. Okay, one way cancer cells grow too fast is by always having more insulin than normal. Okay, cancer cell builds more receptors on their surface for insulin. It is like you're putting a turbocharger on a motor so that they can use up or they can run faster. So this is what happens in cancer cells. So a typical breast cancer cell have triple the insulin loading compared to a non-cancerous breast cancer. And a prostate cancer cell has about twice the normal number of insulin receptors. Unlike in colorectal cancers, they have about 50% more than normal cells of the same time. Okay. Let's look into diet essentials. So this is where we normally receive from the doctor's consultation. It's good for you to be on plant-based diet if you have cancers. And if you're on chemo or a conventional treatment radio, we will include a bit of meat into your diet, mainly fish, but no chickens and red meats. In SOL, we have a protocol that we use for our patients, mainly on raw food and also cooked food. So we have our plant-based nutritionist and also a raw vegan chef. So she will have a consultation with patient, and she will guide patients through a proper diet, which in the end of the slide I will tell you about our program. So it is advisable, strictly advisable to be on plant-based if you have cancer. And dairy, it's completely not of your diet. Also, meat, definitely not of your diet. Um, and the type of oils that you use is also very important. Okay, so dairy naturally contains factors which increases the tumor growth. And this potent growth factor and hormone receptor activator develop when you eat meat and milk, which is already fed with grains. So omega-3 to 6 fat ratio into grain or corn that feed with grains promotes inflammation. So most of the um, meat that we are getting from our grocers already fed with grains. It's very, I mean, you get a very minimal products that you can find that's being fed with grass. Okay, so muscle meat contains methionine and also vitamin B12, which tumors like to feed on it. And milk, definitely cheese, your butter. So they are highly in casein, which also promotes tumor invasiveness, and an enzyme that ramps up digestion in casein kinase is can increase beta-catenin, and this induces survivin, which means it suppresses the cell death and while trigger for the cell to divide more. So this is the reason why your doctors always ask you to stop taking dairy products. Instead, choose more on plant-based dairy, plant-based milk, sorry. Okay, avoid tuna, shark, mainly the mackerel family fish because they accumulate too much of mercury, and mercury is definitely one of the contributors for cancer, mercury toxicity. They inhibit the natural healing, and it suppresses your immune system. Okay, small amount of animal food can be permitted, like what I said, in terms of cancer patients who are receiving chemo or radio, then we allow them to eat fish. And some of our patients are also eating beacon chicken. So those chickens are chicken that is organic, raised organic. So we have to see case by case, and if it is permitted, then definitely we will allow the patients to eat. Okay, and bone marrow soups, especially bone broth, um, organic meat, grass fed, like what I said just now, it is uh, permissible in patients who are taking chemotherapy because they need proteins. Okay. Okay. Eat organic as much as possible. This is sometimes it is not uh, practical, yeah, because one is cost, like what I mentioned, the cost is very high, and sometimes they claim it to be organic. So for some patients, yes, you can grow your own vegetables. If you don't, then definitely you have to get it as organic as possible. Okay, and you have to drink purified water, eat food that is highly in fiber, food that is rich in omega-3. Avoid all the vegetable oils, your soy oil, your corn oil, and then consume healthy oils like olive or coconut. And then no artificial sweets, no artificial sweeteners or any food preservatives, and avoid deep fried, grilled, or even smoked meat. And also try to avoid food that, leftover food. Don't cook today, don't do your meal prep, keep, and then you leave it for a few days and you reheat and you eat, or using a microwave to heat it up, because it it is not longer fresh. Number one, bacterial fermentation happens and it causes more inflammation. So avoid trans fat found in processed food, Soft drinks, definitely no soft drinks. Those are rich in corn syrup, fructose. Avoid oil that you have used several times. Okay, minimize sugars, and then avoid food that is already contaminated with mycotoxins. Most of the coffee beans or even nuts that we are eating is already contaminated with mycotoxins or aflatoxins that I mentioned before. So it is good to, if it is nuts, it's good to sprout them. Sprout them at least overnight, hydrate them, then you eat. And try to avoid taking cereals. Cereals are not a good food. Minimize to no alcohol and eat in a relaxed atmosphere and a calm mind, because when you are not happy with the food that you are eating, when you feel being forced to eat the food that you are eating, it doesn't serve any purpose of give nutrients to the body. Okay, so if you choose to be vegetarian or vegan, remember adequate quality of protein is important. So um, talk to your nutritionist or dietitians to get the appropriate amount of protein to be infused in the diet. And some proteins requirement may come from your nuts. So seeds are very good proteins that you can have, like pumpkin, hemp seed, chia seeds. Okay, and lentils, peas, especially if you're taking any protein powders, vegan protein powders, make sure they are made of peas. Soybeans are best eaten in fermented form. So miso soup, try to have miso in your diet and avoid GMOs, soybeans. Okay, for cooking, try to use sorry, virgin olive oil, because they are not only rich in antioxidant, but there are many study has also proven that olive oil block the productions of harmful PGE2, which is the growth promoter, because they are rich in oleic acid. And nuts and seed contains monosaturated fats, which is GLA, gamma linolenic acid. So they have also shown, in many studies, shown to slow down the growth of new blood vessels around the tumor. That means they have reduced the angiogenesis, and also they lower down the level of tumor promoters and decrease estrogen receptor expression, especially in cases of prostates or even breast cancer. And it is okay. What are the good source of gamma linolenic acid? Evening primrose, borage, or even a black currant oil. Okay, what are those bad acids? Bad fats. Okay, these are the fats that is our trans fatty acids. So they comes from hydrogenated oils, or like what the oils that are being used overheated, especially in frying foods or grilling. So they promote mutations, and they are pro-oxidants. So try to avoid them. And all your vegetables oil, if you have vegetables oil at home, sunflower oil or daisy oil, throw them, because they are not only causing inflammation, but it's also promote mutations in longer run. Okay, any questions so far? Let me look at the chats.
Yes, doctor, there's actually one question.
Is breast and ovary cancer patient advised to? Okay, there's one question. Okay, I'll answer this question at the end of the session. Yeah, okay. All right, next will be botanical medicine with highest level of anti-cancer and immunomodulatory agents. So what is botanical medicine? It sounds very It sounds like herbs. Yeah. So botanical medicines are those medicines which I've mentioned just now, which has proven, and they have data, evidence-based medicine, which proven to have anti-cancer properties. So some of it are curcumin, quercetin, green tea extract, modified citrus pectin, mistletoe, astragalus, resveratrol, milk thistles, and also medicinal mushrooms. So I just gonna go through few of it, yeah, because botanical medicine are used widely used in integrative oncologists, or even in for any other treatment in integrative medicine, in functional medicine. So because it has proven to have anti-inflammatory, gene stabilizations, and it also cause an anti-angiogenic effects. So in recent studies, a study by Boyd 2001, he has listed fungi and also vascular plants which has significant anti-cancer, and he ranked by the level of highest to the lowest level. So turkey tails known to have the highest anti-cancer properties, followed by genistein, bromelain, astragalus, quercetin, green tea extract, boswellia, boswellic acid, ganoderma, shiitake, curcumin, garlic, resveratrol, and anthocyanins from berries. This is an interesting study. It's good to go through the study to get a better understanding on. He has listed, in fact, he has listed 21 what called 21 by botanical medicine, which has the effects on particular cancers and also the dosages as well. Okay, so curcumin is quite a famous or used by many of us, not only in cancer. We use this for rheumatoid. We use this to, in cases of skin conditions, or even autoimmune conditions. So other than serve as an anti-inflammatory properties, curcumin regulates cell signaling pathways involved in cell growth. Okay, it inhibits inflammatory compounds linked to cancer initiation. So turmeric blocks compounds that trigger inflammation, so which can play a role in starting the cancer. So this includes cytokines, chemokines, adhesion molecules, growth factor, and also the other nutrient functions. Okay, so other than that, it activates cancer cell death. We call that as apoptosis, and it also causes changes in gene expression that is unfavorable to for the cancer to grow. So many of us are consuming curcumin in powder form, in capsule form, or even you make that as as juices, or you use that in your cooking. Okay, but there are certain things that need to be taken into consideration. For those who are on anti-platelet properties, or medications, or anticoagulants therapies, it is advisable not to take, or if you take, to be taken in a lower dosage. Okay, turmeric typically has minimal side effects, but studies have shown that people can tolerate up to 8,000 mg of curcumin daily for 3 months without any side effects. But in our general practice, we usually give patients not more than 2,000 mg per day. Okay, so to start with, a typical oral dosage can range from 1,005 daily. For some patients, when they take curcumin, they develop into GIT issues, so they may have reflux, they may feel a little bit on the gassy, and in some cases they also feel a bit of lethargic or dizzy. Okay, so it is good to start with a very minimum dosage. Start with 500 if you have complaints as such, and then gradually increase to 1005 mg daily, and you can go up to 2000 to 2005. And it is good to take on liposomal range, or you can also get it in an IV form. Okay, another famous botanical medicine that used in cancer, or even in cases of treating autoimmune and allergies, is quercetin. Okay, they are highly in antioxidant, and quercetins and also some other antioxidants need to be given carefully. If the patient is taking chemotherapy, then make sure get to know what type of drugs they are taking. Some of the medicines like doxorubicin and cisplatin are not advisable to take quercetin, mainly because of the antioxidant properties. Okay, so they are highly in anti-inflammatory, antiviral, anti-cancer. And if you have if you're fighting with some, not only in cancers, but let's say if you're fighting with some allergic responses, so this will be the first thing that you can consume, because they're highly in they are also known as a natural antihistamine. Okay, so studies shows that quercetin helps stop cancer cell growing, and it acts as an antioxidant, fight tumors, and reduces inflammation. It triggers the apoptosis by boost enzyme that protect against cancer-causing substances. Like I said, the safety measures is be very careful if you're taking any antibiotics. So don't give your patients already on any antibiotics, blood thinners, and chemo drugs. Okay. Um, for cancer patients, the dose will range from 1000 to 2000 mg per day, but it is always good to start with 500 and then gradually increase to 1000 to 2000 mg, because what happens is some patients may have or complaints of you feel heaty, or there is some changes in terms of your bowel movement, or in minimal cases you can have rashes. Okay, so next will be, modified citrospectin, MCP. So this is quite a famous supplements, or even a botanical medicine used in cancer treatment, mainly because of one reason, because they are known to be toxic metal chelators. So they act as a chelators. They bind the toxic metals and also excrete out of the system. So what happened is MCP worked against cancer by blocking a protein called galectin-3. So this protein helps cancer cells stick together, move around, and form a blood vessels for tumor. So they avoid dying and spread to other places. So MCP is something that should be given to our cancer patients, and they have to consume on a daily basis at least for 3 to 6 months. And for those who are sensitive or have an allergic to citrus-based products, it is advisable to give it in a very minimal dosage. It comes in capsule forms, it comes in powder form. So this MCP, it targets all the pro-cancer effects of galectin-3. It induces cancer cell death by interfering with the signal pathway related to proliferation and survival. Okay. It also boosts your immune system, enhance the effectiveness of certain chemotherapy, and prevent from forming more new vessels, which is known as angiogenesis. The safety measures will be if you have digestive issues, because the only symptoms or complaints that patient may develop is loose motions, gastric-like symptoms, or even diarrhea. Sorry, yeah, diarrhea. And minimal cases, you may develop into nausea. You feel acid, more acidic, and you may have more eruptions. So these symptoms can be reduced by lowering the um, MCP dosage. Okay, so for those who are diagnosed with cancer, it is recommended to take 5 gram with water. You have to mix with your water, or you can mix with your juices and then take 3 times a day. Okay, but it is advisable if you're just looking for a prevention measures, then 5 to 10 grams or even lower than 5 grams is sufficient for 3 months. Okay, next will be quite a famous botanical medicine now widely used in many form, IVs, injections, and also in oral supplementation, which is mistletoe. And immunotherapy, it is known as an immunotherapy. I will attend to this question at the end of the session. I can see a few questions here. We are coming close to the end of the sessions soon. So mistletoes act as a immunotherapy. So they boost NK cells, they destruct the tumor cells, and they reduce the recurrency. Okay, and it is good to take in an oral form and also in an IV form or a injection form, both way. Okay, mistletoe significantly enhances natural killer cell activity, and it promote the anti-cancer response. So if you're familiar with mistletoe, this plant has been there for many years, and it has ancient times, and it has been used for many other conditions, especially treating virus and also immune-related diseases, and now widely used in cancer. And it carries a lot of studies data, and it is proven to work more on the work as an immune modulator or immune stimulant. Okay, resveratrol. This is another famous botanical medicine that we consume on a daily basis. We get it from berries, or we also take from supplement form. Okay, they are again antioxidant that shield cells from free radical damage, and they also stop cancer cell from growing. They may also block estrogen effects. It works wonderful with prostate cancers and also breast cancers if you're taken in a higher dosage, but the recommended dosage will be only 250 mg to 1000 mg, because again resveratrol also disturbs the guts, and you may have a lot of gut symptoms, so it's always good to start from a lower dosage. Okay, turkey's tail. There are many types of mushrooms. As we mentioned just now, the turkey's tails cause the highest anti-cancer properties. So again, they also known as a inhibitors. They also known as cytotoxic agents. So how it works, it contains a compound called beta-glucans, which helps the immune system to fight against the cancer. So it also, in many cancer patients, the the immune has been weakened. If you can see the blood works, the lymphocytes will be low, and they are very frail. So to start taking Turkish tail will resolve the issue, and they trigger apoptosis. They reduce the growth of cells and increase the expressions of genes related to immune responses. So when you are taking Turkish tail, it is good to also include other form of medicinal mushrooms like shiitakes, and also you also have reishi, and there are also many mushroom based supplements which comes with 7 combinations, 5 combinations. So talk to your doctors. This medicinal mushroom doesn't interfere much with whatever chemo drugs that you are taking, but antioxidant does. So if you feeling tired, frail, and lack of energy, and your blood counts are low, the first supplement that you have to start with will be Turkey tail. Okay, so I would like to introduce to you SOL home visit. So what we do here in SOL is, other than educating patients on what are the supplements they have to take, what are the diet that they should be on, we also do a home visit. Okay, so this will be conducted by our certified plant-based nutritionist, and also she is a raw vegan chef. So she will go to your place, and she will look at the kitchen, she will look at the products that you use for your cooking, and she also consult you in terms of your regular diet patterns, what are the food that you have been eating all this while. And this is mainly a very exclusive program for our designed for our patients to revamp the whole kitchen, to revamp the whole kitchen, to revamp the products that you have, to give you a grocery list, and to teach you on how to, number one, prepare your meals. What are the ingredients that you have to include in your cooking, and what are the utensils that you have to use for your cooking. So it is not only an education session, but it's also gonna teach you on what need to be included in your kitchen and what need to be thrown away, that thrown away, and you're gonna have a better lifestyle. And this is going to make you to learn on what you have been doing wrong all this while, and now it's going to help you to prepare, cook a good meal for your family in a correct manner. So this will be like a day program, which is about 4 to 6 hours visit to your home, and then she and the team will be talking to you on the whole programs, and they will also work with you throughout the session. So for those who are interested or to know more on this home visit, you can contact us, and this is something that all of us have to be very mindful of, because um, we are only focusing on treatment, we are only focusing on what we can do to target the cancer cell, what we can do to address the issue that we are facing now. But as for a long term and to promote a good quality of life, a diet change, a lifestyle change is very important. What more? How you cook, what do you buy, where do you buy from, what are the sources, where do you get it from, is even much important than the treatments that you are doing. Because we believe that in cancer management or the treatment, 30 to 40% comes from the treatment, and 60 to 70% is actually from the food that you eat. So it is very important To get this program, enroll yourself in this program, learn about how you need to cook, what you need to use, and get a proper diet and tailor-made diet plan for your conditions. Okay, and we also, in SOL, we also have RGCC oncolomy extract testing. So this is a test, a blood test, that will identify the effectiveness of natural substances for cancer management. So this test is going to cover all the natural substances and plant extracts which has anti-cancer properties, and your blood will be tested against it on how effective these substances are going to be in your cancer treatment. Okay, it is a very a thorough, detailed test. It's not only going to look into other drugs that you can use for, if somebody who's considering chemotherapy, then yes, they also can get it done. That's a different test. But for those who just wanted to understand better on what are the natural substances that I can include for my treatment, and whether or not I am, whether or not I have effectiveness, those substances has effectiveness towards my cancer, then this is the test that you have to do. And this test is mainly covered by 3 classes. So class number 1, it has cytotoxic agents. So these are the substances that are used to kill the cancer cells. So your blood will be tested against the substances and effectiveness. And class 2 will be more on the immunostimulants and immunomodulators, mainly to work on the immune system. The class 3 will be the PK inhibitors. So these are the substances that involve in blocking the enzymes, certain enzymes pathways. So this would be a very good, I would say this is very comprehensive test. It comes, it also gives us your sensitivity towards certain treatments as well. For example, hypothermia, and also some other treatments. So I would suggest for those who still finding or contemplating on what supplements that you have to take and thinking whether or not it's going to be effective, then get your RGCC oncology extract done. Therefore, you get a bigger picture on where and how you can start with a natural approach. So these are the I'm sharing some reports with you. So this is how the report is going to look like. So you have class 1, class 2, and class 3. So the blue line here is showing that it shows no sensitivity towards that particular substance. For example, if you can take ascorbic acid, vitamin C, or if you can look at the artesunate. Okay, so this patient has shown less effectiveness towards artesunate, unless the ascorbic acid, the patient shows 30% of effectiveness. In some other like butyric acid, it shows 0% of sensitivity. That means this will be a tool for your doctors to give you the right supplementation. And because nowadays we have been taking everything under the sun and not knowing whether it is helping us or not, because like for example in class 2 immunostimulants, you can see that this person has been tested for immunostimulants and shown to be not effective for any type of immunomodulators. So when you do this, you get a bigger picture of, okay, what are the supplements that I can take and what is the level of sensitivity towards that particular substance. Okay. All right. So thank you Let's look at some of the questions. Does SOL sell quercetin resveratrol supplement? Yes, we do. What is the test? What's the cost of the RDCC test? Okay, the cost of the onconomy, they have many other tests, but especially for the onconomy extract, it will cost you about 6,000 plus. Okay, how to get rid of arsenic in drinking water? How to get rid of arsenic in drinking water? So then you have to change the water that you are taking. But if you are tested for arsenic poisoning, it is advisable to go for a detoxification. But normally for arsenic toxicity, we do an ozone saline for patient to get rid of it. What is the most bioavailable B6, B12, which is often lacking in? What is the most bioavailable B6 and B12, which is often lacking in plant-based diet? Okay, so if you were to take B6, B12, and if you're looking at the bioavailability, then I think the liposomal range will be good. Patient with cancer takes antioxidant-rich supplements to reduce side effects while chemotherapy and oncology. What is that? Okay, as I mentioned just now, patient, yes, antioxidant supplements, it's something that have to be very careful when you're already on chemo drugs, because like I said, there is an interference between the drugs that the patient's taking and the antioxidants rich supplements, because like I said, the mechanisms of those chemo drugs, it causes oxidative stress. Okay, through the process of killing the cancer cell, it causes oxidative stress. So antioxidant has an opposite reaction. So now what happens is it blunts the effective of the chemotherapy. So that is why usually it happens that doctors, oncologists especially, will ask patient not to take any form of antioxidant. But if you are taking in oral with an interval of 6 to 8 hours after the chemo drugs, it's still in a lower dosage, is permissible, but not in IV forms or in a larger dose. Okay. What is the substitute for rice, since rice become a staple food of many? Very good question, because everyone asks this. A good substitute for your rice will be quinoa, millet. Brown rice is still, we do allow brown rice, but if you were to include more protein in your diet, then quinoa will be good. So that's about it. Okay.
Hi, Dr. Lydia. Sorry to interrupt. I just want to mention that we have to wrap up the webinar as soon as possible, because your patient is already here.
Oh, okay. All right.
Sorry, yeah.
No worries. Okay. So I think I've answered all the questions. If you still have questions, you can write to us or visit us for a consultation.
All right. Thank you so much, Doctor, for your time today. That was very insightful. I hope everyone has gained some new knowledge today. If you guys would like to make an appointment with Dr. Lydia, please feel free to scan the QR code. We currently have the first trial session promotion, which includes a consultation with Dr. Lydia, an in-body test, 20 minutes hyperthermia trial treatment, and quantitative fluid analysis test. And it's all only for 500 ringgit. So again, if you would like to make an appointment, please scan the QR code. Thank you so much, Doctor. We will also send the playback of today's webinar via your registered email. Thank you, everyone. Have a good day.